Hey, before we get started, I just want to let you know the information provided is not meant to be medical advice. So if you have any medical questions, reach out to your doctor and start a discussion. Enjoy the show. Hey, welcome to the Lichen Sclerosus podcast. My name is Kathy, and this is our journal of learning about and living with lichen sclerosus. Each week, I research an aspect of lichen sclerosus, bring you the information, and tell you how it's affected my life. Let me ask you a question. What would you do if your topical medicine stops working? I mean, think about it. Remember when you first started having symptoms, itching or burning, or maybe you had fissures, and you didn't know what it was? Remember how scared you were? You're thinking to yourself, what is going on? And going to the doctor and getting a diagnosis, trying medications, they're not helping. You're getting more and more desperate. And then you have that final thing that really freaks you out, that has you on WebMD just searching all kinds of symptoms and just making you so crazy. And remember going to the doctor that last final time before you got your final diagnosis, and then telling you that you have lichen sclerosus and it's non-curable. Remember how devastated you were? That here you were, you finally got an answer after all of this time, and they're telling you that you're going to be dealing with this for the rest of your life. But then you looked on the bright side. Okay, I got an answer. I know what it is. I can treat it, and I'm going to make the best of this. So you start using your medication. You're getting really better. You know, you have an occasional flare up here and there. But then imagine that your medication stops working. Imagine that you're having flare-ups instead of once a month or once every couple months, and now you're having flare-ups every week, every other day. And you know something is not right. And now you know what you got. You know what this disease can turn into. So imagine how petrified you are that the one thing that is supposed to stop your progression has stopped working. And now this lichen sclerosus thing is just chugging away down the tracks, getting worse and worse and worse. How desperate would you be? Would you be desperate enough to try something that might only have a 50% chance of getting you better? What about 70? What about 90? What if it's not FDA approved? Are you willing to chance it still? Okay. How about if you're not guaranteed it's going to stick? Would you still try it? Would you be willing to pay out of pocket thousands of dollars to stop the progression of your lichen sclerosus? I know I might. I don't have thousands of dollars, but I might just have to find a way. Because we know what this can turn into. And nobody wants to go down there willingly. Not if we have a choice. So today we're going to talk about what those choices are. There's 3 top alternate medical treatments. None of them are covered by your insurance. So that means you're going to have to come out of pocket. And they range anywhere from $1,200 up to $3,000. And it can go up depending on the doctor that you're seeing, depending on the size of the office, depending on where in the country you go, depending on where you're seeking the treatment. I should say it's not covered by the insurance here in America. I don't know about other countries. So it could cost us anywhere from $1,200 to $3,000 on up. The first treatment we're going to talk about are the fractional CO2 lasers. You may have heard them called by their brand name. There's the Mona Lisa Touch. There's the Core Intima, and many more. Just depending on what doctor you go to, they call it by a different name. And how these work is they remove layers of skin with a laser. And the whole thing is that when the skin rejuvenates, that it's healthy and cures your lichen sclerosus symptoms. So does it really work? Well, fortunately, 2 recent studies have been published and gives us a lot of information on what these lasers can do for lichen sclerosus. I will have them in the show notes. You can find that at lichensclerosuspodcast.com/other treatments. The first study was sponsored by MedStar Health Research Institute, and it was just published on March 1st of this year in the American Journal of Obstetrics and Gynecology. They wanted to see if laser treatment gave better results than our topical steroid treatments. What they did was break the women up into 2 groups. One group of women was given 3 sessions of the Mona Lisa's Touch laser treatment every 4 weeks. The second group of women were given a topical steroid and were told to apply it nightly for the first month, and then 3 times a week for the second month. After they got the treatments, they checked them after 30 days and then after 6 months. At the 6-month checkup, what they found was that 89% of the ladies who had got the laser treatment said that their symptoms were better or much better compared to only 62% of the women who had the steroid treatment. Overall, more patients were satisfied or very satisfied with the laser treatment compared to the steroid treatment. The only complaint was minor burning and blistering on the laser site. Other than that, they didn't have any side effects. Seems pretty good, right? 90% chance. Now, they did not do a follow-up after 6 months. So we don't know how many of them still are satisfied. The second study was published in December of last year in the Journal of Obstetrics and Gynecology, Canada. They had similar results. They took 40 women with lichen sclerosus and broke them up into 2 groups. One group was given the laser treatment. The second group was given the topical treatment. They followed up with them at 1 month and 3 months. They found that at the 1 month and the 3 month checkup, the patients with the laser treatments reported greater improvement on all of their symptoms, which was burning, itching, pain, and pain during sex. And they had better satisfaction than the patients that were on the topical steroids. So their conclusion was that laser therapy was a good alternative to topical steroids for women who either the topical steroids are not working for them or who don't want to use topical steroids long term. Now, once again, they did not go back and check how these ladies are doing after 6 months. So we don't know if their symptoms came back or how they're feeling. So the second type of treatment I want to talk about is called platelet-rich plasma, or it's known as PRP. And this is when they take your blood and they make a serum with it, and they inject it back into your vulva. And what it's supposed to do is to encourage tissue regeneration, improve blood flow, and healing. If you'd ever heard of the O shot, that is a platelet-rich plasma treatment. So there were a lot of older studies that showed that PRP might be a good treatment for lichen sclerosus. Problem with those studies is that they were not comparison studies. They just took either a single woman or a group of women and followed their progress. But in 2018, there was a study published in the Journal of American Academy of Dermatology, and it was funded by the Gynecologic Cancers Research Foundation. And they decided to do a double-blind test. So what they did was they took 30 women, but one of them dropped out. So they had 29 women, and they broke them up into two groups. One group was given 2 treatments of PRP separated by 6 weeks. And the second group was given 2 treatments of saline separated by 6 weeks. Neither the doctor who was administering the test or the patients knew who got the saline and who got the real treatment. They took pictures and had a doctor analyze them to see if there was any improvement. At the end of the study, out of the 19 women who actually had the real treatment, only 5 of them showed improvement. 10 of them had no change, and 4 of them were worse. And out of the 10 who got the saline, the placebo, 5 of them had improvement, and 4 had no change, and 1 of them was worse. So in the end, they concluded that until there's more real comparison studies, they did not feel that the PRP was a good alternative treatment for vulvular lichen sclerosus. Again, they did not go back and check and see if the ones that were improved, if their symptoms came back, how long did it take for them to come back? None of that. But it looks like only 26% of the ladies who had the real treatment actually had any improvement. And PRP is painful because they take a needle and inject a local anesthetic to where they're going to laser. But you have to withstand that needle going into your vulva. So, yeah. I don't know about you, but I'm not really looking forward to paying thousands of dollars for you to prick me with a needle in my most sensitive spot and then only have a 26% chance that it's going to help me. And then I don't even know how long it's going to help me for. I don't know. Something to think about. So the last treatment we're going to talk about is called ultrasound therapy. What it is ultrasound waves that are concentrated in a certain spot and sent through the tissue, and it's supposed to carry the energy into the tissue. And then I guess just like the laser is light energy, these are sound wave energies. So I couldn't find any current studies, but I did find a study from 2017 that was done in China over a 5-year period. And what they did was give 44 women with lichen sclerosus 1 to 2 rounds of ultrasound treatment. Some of them got better over 1 treatment, some required a second treatment. Now, they did also study other forms of lichen as well, but I just took the results from the vulvular lichen sclerosus patients. So there were 44 of them, and they actually went back and reviewed the patients after 3 months, 6 months, 1 year, and 5 years. At the 1-year checkup, 23 of them were cured. That's 52%. They had no symptoms. And 17 of them, or 39%, had showed some improvement. Okay. Almost 90% altogether showed some improvement, right? But at the 5-year checkup, when they went back to check on these ladies, 12 of the women who have been cured, 12 of those 23 have regressed to their prior symptoms. So that means out of those 23, only 11 of them, 11 out of the 44 were cured after 5 years. I don't know. That don't seem like pretty good odds to me. It's like 25% of the original 44. I don't know. But it's not painful. The only side effects that they showed were blood and water kind of coming to the surface of the skin, but that cleared up after a week. So there is one doctor who actually came up with a kind of a combo, and that's Dr. Coyle. He has developed what's called the Tulip procedure. It's a single treatment, and what he's doing is he's combining the CO2 laser treatment with the PRP treatment. He's saying that he has 100% recovery from lichen sclerosus with this procedure. There haven't been any studies. The procedure's pretty new. He still has a patent pending, so don't know if it's true. But I do have an interview coming up with a patient who has gone through the Tulip procedure. So we will see if Dr. Coyle is telling the truth. So there you have it. If our topical treatments do stop working, we do have some medical alternatives. Granted, they're not FDA approved. They're going to cost us thousands of dollars. They may be painful, and we don't know how long they're going to last. But there are options. If you've had any of these treatments, please leave us a comment on the show notes page, lichensclerosuspodcast.com/other treatments, and let us know why you did it, how the procedure went, and are you symptom free? Are you happy you did it? We want to know. Or if you want to come on the podcast and talk about it, I more than welcome you. Just shoot me an email and we'll set it up. So that's it for this week. I hope you guys are being safe. And don't forget to join me on Instagram. I'm at Lichen Sclerosus Podcast. And I will see you next week. Bye.